Hi,
Hello.
Mr. Nandi.
Thank you.
What's your name?
My name is Nandini.
How old are you?
I'm 16 years old.
Okay. Will you allow me to do ASCII videos?
Fine.
Okay. Do you have any problem in that?
No. Fine.
Okay. Let's proceed to the videos.
Okay.
How long had your cough?
Doctor, I'm suffering since a couple of months.
Did your cough started with an illness or lung infection?
Yes, doctor, my cough started when I was in ill, but I don't know whether it may be lung infection or not.
Okay. Do you cough all the time or during activity?
During some activities.
Do you cough after meals?
Yes, doctor, whenever I used to take some dessert after meal.
What time of the day is your cough worst?
At night time.
Okay, do you cough up mucus?
Sometimes, doctor.
Do you have chest discomfort with your cough?
Whenever I cough heavily, I feel some discomfort in the chest region.
Okay, this is the past history of the 16 years old woman.
And today I'm going to perform the physical examination for cough. Can you please breathe normally? Okay, the respiratory rate is normal. Now I'm going to check for any abnormal sound in the lungs. Can you please breathe? Okay. Okay, can you please lean forward? Breathe now. Okay, there is no abnormal sound in the lungs and it is just normal cough.
I'm going to do physical examination for this patient for cough. For physical examination, we have to place the stethoscope at the back and ask the patient to take a deep breath. Can you take a deep breath, please? Be relaxed. While examining this patient, we heard a murmur sound. It confirms that she had a mild cough.
Classification of cough includes acute cough, less than 3 weeks duration, subacute cough, 3 to 8 weeks duration, chronic cough, which is more than 8 weeks duration. Acute cough includes viral syndrome, sinusitis, pertussis, pneumonia, etc. Red flags in acute cough includes hemoptysis, breathlessness, fever, chest pain, weight loss. Signs include trachopnea, cyanosis, dull chest, bronchial breathing. Subacute cough includes post-infectious cough that begins with acute respiratory tract infection, not complicated by pneumonia, resolves without treatment, cause tracheobronchitis or PND, indication of CXR with automated biopsy needle, lung exam, sinusitis, asthma. Associated symptoms includes fever symptoms. Recent symptoms include pneumonia, postnasal drip, sinus congestion, headache. Associated symptoms includes fever symptoms. Recent symptoms include pneumonia, postnasal drip, sinus congestion, headache. Complications includes cardiovascular complications such as arterial hypertension, loss of consciousness, rupture of subconjunctival nasal veins. Neurologic complications includes cough, syncope, headache, cerebral embolism, CSF rhinorrhea. Respiratory complications includes pulmonary interstitial emphysema with potential risk of pneumatosis intestinalis, pneumomediastinum, pneumoperitoneum, pneumoretroperitoneum, pneumothorax, subcutaneous emphysema, laryngeal trauma, tracheobronchial trauma, exacerbation of asthma, intercostal lung herniation. Thank you.
Signs and symptoms. Coughing fits, woofing, and vomiting after coughing fits occur less often. The percentage of children with apnea, long pause in breathing, sinuses, blue purplish skin coloration due to lack of oxygen, and vomiting is less. A cough can be caused by a viral infection that persists for more than a couple of weeks, will probably require medical attention. Characteristics of cough. The cough when it's getting worse, swelling present in neck region, difficulty swallowing, difficult in breathing, dry throat, increased pressure in the throat and lungs with vocal cords closed.
Diagnosis, causes and risk factors of a cough. Acute coughs and chronic coughs have different causes. The common causes of acute cough includes common cold and influenza, inhaling an irritant such as dust, chemicals or a foreign body, pneumonia, whooping cough, acute bronchitis and sinus infections. The most common causes of chronic cough includes allergies, asthma, GERD, that is gastroesophageal reflux disease, postnasal drip, chronic bronchitis, COPD, that is chronic obstructive pulmonary disease, other lung conditions, smoking, and throat disorders. So how cough is diagnosed? Your doctor will start by taking a detailed medical history and asking about the nature of your cough, when it gets worse, when it gets better, and if you have additional symptoms. If your cough is associated with other symptoms such as fever, chest pains, headaches, drowsiness, confusion, coughing up blood, or having difficulty breathing, it will likely require further tests. Commonly, these include blood tests, sputum or mucus tests, imaging tests such as chest X-ray or CT scan, spirometry, or a methacholine challenge test.
Physiology and lab work. Cough is composed of three phases: inspiration, compressive, and expiratory, and it serves a vital defense mechanism for your lung health. Patients with cough frequently present to the clinician, which is working for both acute and chronic cough. Coughing is an important reflex that helps to protect your airway and lungs against irritants. Cough can propel air particles throughout your throat, which is normal help to clear throat, airway germs, and mucus. This is the physiology of cough, where somebody is afferent pathway activated and cough center efferent pathway respiratory pathways are activated, where peripheral nerves, spinal vagal nerves are playing very important role. Laboratory management of specific irritants, asthma, eosinophilic bronchitis. Recommendations such as cough is unlikely to due to eosinophilic airway inflammation. There is no response of 2 week oral steroidal trial. Environmental recommendation is smoking cessation should be encouraged as accompanied by significant remission of some symptom, upper airway pathology, undiagnosed and idiopathic cough. Specialist cough clinics, specialist investigation, bronchial provocation testing, esophageal studies, upper airway investigation, cough provocation testing, measurement and monitoring of cough, assessing airway inflammation.
Management. Cough is very common. One of the most important things to remember about cough is that it can be divided up into a number of sets of causes, include infective cause, allergic cause, due to aspiration, environment, irritants, or very occasionally physiogenic cough. It's important to keep in your mind this list of differential as you are going through the history and examination. Also remember all the extra stuff that you need to ask for the pediatric history, such as social history, birth history, development history, and vaccination history, so that its broadcast many.
16-year-old girl with cough treatment. Liquid cough drops, vaporizers, lagogens, and steamy showers may help to soothe a cough. If the patient may look like she needs a cough medicine, we can suggest. If the cough is severe, then we may proceed with further laboratory procedures. The patient is 16 years old, that means she is an adolescent age, so we can also assume that the coughing is caused by smoking also. We can also use cough repressants such as dextromethorphan. We can also suggest amoxicillin, which is an antibiotic prescribed for persistent coughs caused by chest infection, like bronchitis, etc. Asthma medications prescribed by your allergist will help to retrieve the coughing attacks. This include fast-acting bronchodilator inhaler, which expands the airway in the lungs and offers quick relief. Warm liquids such as caffeine-free tea broths with hot water and lemon can also help lower mucus and soothe a sore throat. Consider use of a humidifier. A cough is a symptom, not a disease. Flu, asthma, bronchitis, smoking, allergies, stomach acid that get back into your throat can also cause cough. Thank you.